and I'm still sending my consolidated communication, my telephone bill to St. Louis, so that's out of the question. But my power bill goes to Quincy, which is 30 miles away from Bristol, and my Waste Pro bill goes to Tallahassee, which is 50 miles from Bristol. But my bill, even if you put it in the local slot at the post office, all of it out of town, I don't see why they got the local slot, because all of it goes to Jacksonville.
Yeah. Charles, I get this question a lot about the Postal Service, and nobody I think ever ran for Congress because he thought they were going to fix the postal system, but all of us get tied up in this. So certainly they don't have all the full services, the automated services in every town to handle the letters and everything. So, and we know that the Postal Service loses money. I think it loses money, honestly, frankly, year after year. We have found occasional criminal problems and fraud problems in the Postal Service, but I would say it certainly isn't rampant. What we have more of is inefficiencies, and it reflects a huge amount of mail moving, and honestly, an inability to handle it locally. And sometimes they get behind. I get a lot of complaints these days about the postal system. Sometimes it's those collective boxes, post office boxes, where they want to drop mail and you have to come and get it, which presents a problems, obviously, for packages and things. We're still working on this. I haven't got a global answer for all the things that I hear about the post office these days, but I think we're going to have to work on it. I worked in Tallahassee. They had a particularly grievous problem in one part of Tallahassee, and we've been working with them. We have a new Postmaster General in place. We've been working with her on that. So I'm going to plead a little bit of ignorance to you, answer your question, but I do want you to know that we're following it, we're working it, we're trying to get to the bottom of it. We're trying to help the post office as much as we can, and then correct whatever we need to correct as we go forward. So that's a tricky question, but you can always reach out to my office and let them know what your problems are with your post office locally, and we will get them answered. And that's whether you call our offices in Tallahassee or in Panama City. Thanks so much for that, Charles. Next we have Randall. Randall in Marianna. Randall, go ahead. What's your question?
Yes,
Randall? Yes, there he is.
Okay, I'm actually in Tallahassee, not in Marianna. That's what kind of offended me. But my question is this. Under the last administration, the Biden administration, they expanded Medicare and Medicaid quite a bit.
Yes.
They added people who weren't senior citizens like myself, weren't retired people. And I've noticed now so far this year with my Medicare Advantage plan, I've been experiencing cutbacks. My crown would no longer be covered, which I needed. Cavities would no longer be covered. The only thing that would be covered are x-rays and cleanings. I went to my medical advantage program offered me $40 a quarter for medicines and what have you. I went to get some medicines yesterday because the quarter was about to end, and I was told, well, no, that program is now gone as well. And so it's like, because the Biden administration has expanded Medicare and Medicaid, now seniors are suffering. And if we're on fixed incomes, I'm hoping that you could perhaps do something about that and provide at least the same level of support to our Medicare and Medicaid programs, care I'm talking about, where, I'm paying into it every month, and but I'm getting cut back.
Okay, so let me ask you a question, because I think I want to separate this into two questions. Were you on Medicare Advantage in years past, or just straight Medicare?
No, it's Medicare Advantage. I've always been on Medicare Advantage.
Okay, so Medicare Advantage is actually a contractual arrangement between you and whoever you chose for the Medicare Advantage. If you stay on plain, straight-up Medicare, the benefits have not changed. Between Medicare Advantage, which is a chance to save money if, in fact, you're healthy or you have just exactly the right illnesses that are covered under that particular Medicare Advantage plan. So it's a little bit like, you're running the traps to try to figure out how you can game that system and pay the least and get the most. And it's very, very possible to take a Medicare Advantage plan that simply decreases your benefits paid out and that you're more out of pocket, although the actual premiums per month probably cost you somewhat less. All the co-pays and the coverages can change dramatically. Now, the expansion population in Medicaid is an entirely different problem. And what that has to do is taking Medicaid, making it available to a whole lot of people that Medicaid was never intended to cover, which is basically the working lower middle class poor, people at 130% of poverty level and things like that. It's intended to take care of the elderly, the poor, the disabled, the mothers, the pregnant women, children at home, that kind of thing. And those people, their benefits haven't changed at all, except now we've spread this, we've made this Medicaid program cover a whole lot more people that didn't fit into that classic Medicaid population at all. And what's more, they cost the federal government a ton of money because the states and the federal governments are a share in the cost of Medicaid, but the share in the cost of Medicaid for those relatively healthy, young, the people who wouldn't normally have been on Medicaid the way you and I think about it, that expansion population, that's what they're called. This is the Affordable Care Act. That's what it is. It includes now a whole new ream of people. They get their federal government share is 90%. It can be more briefly for a few years, but call it 90%. Whereas most of the Medicaid population, the federal cost share runs about 60-70%, and the states pay the rest of that. So it became much, much, much more expensive for them. And they're splitting the money under more people, which also affects the rate at which things are paid and service and all that. So Medicaid is its own set of problems, and Medicare has a different set of problems. And the ones I think you're referring to are related specifically to Medicare Advantage program. And I urge you to take a look at that Advantage program and kind of compare it to what a straight up, just Medicare, straight Medicare would cost and what kind of benefits you would take out of that, because it sounds like you stand to gain by staying in the regular Medicare. And by the way, I'm not the expert on this, but there are people both in my office and in the Medicare office who are and are willing to work with you on that as well. That's a good question, Randall. It's a little more wonkerishly deep than most of them, but thank you for that question. One that we got in from the online audience, and it's I'm going to call her Dr. Carolyn. I won't give the last name. I don't know. Oh, former Army physician. Hey, that's me too, right? I'm extremely concerned about cuts to the VA. What are you going to do to prevent these layoffs and disruption of essential services and personnel? Well, great, Dr. Carolyn. Again, I am in the exact same situation you are. I'm a doctor, former Army doctor, and I want to protect VA. And by the way, President Trump has said, hands off the VA benefits. Everybody, the benefits stay as they are. And so we're not touching benefits. We're not changing who's eligible or anything like that. And in terms of the employees, the number of actual employees, no patient care slots are touched unless there's somebody who's culpably not doing their job. That has nothing to do with Doge or anything. That's just pruning the branches as you need to. But you heard me say, I think earlier, that the total number of cuts in our entire VA region, and that's North Florida, South Georgia, the largest of all the VA regions in the country, with the most employees, 6,600 full-time employees, 20 people were released, all new hires on probation. And, when you have a RIF, a reduction in force, first to go are usually the latest in. The most recent in is the first out. 20 people out of 6,600. Just to put that in perspective, that's 3/100ths of 1%. 0.03%. 0.03. It's kind of hard. I mean, this is not going to impact care, Dr. Carolyn. I think you and I could agree. If you're an Army physician, I think you wouldn't even notice that many people are kind of. I'm trying to think. That's a whole division, and you lose 20 people. For comparison's sake, for military comparison's sake. And thank you for your service, Dr. Carroll. Next, we have from Panama City, Daniel. Daniel from Panama City. Go ahead. What's your question?
Good evening, sir. One of the things I've noticed here, particularly coming from the last administration, but previous administrations also, and the way that these laws are written is that they give, instead of using words like shall and will, they use words like may and can. And when you're parsing out a bill like that, either for immigration or whatever, whenever you give the administration's wiggle room, they're going to take it. Why aren't you guys, when you're writing these bills, using these words that do take away that wiggle room, where they can't say, well, I've got the option to do this?
Well, so thank you for that. And let me say that you sound like you're one of my colleagues in Congress, any one of my colleagues in Congress, who we sit around here saying, how the heck did we end up with a law that's this loosey-goosey? I mean, we need to tell the agencies, we need to compel them to do what we're trying to get them to do, not just kind of authorize them to do it and hope they'll do the right thing. And so when you're writing bills, it does behoove you to be very, very careful about these bills as you write them. And I will tell you that it's a little trickier than it looks like to hit all the legal language, because you also have to hit all the citations for the other laws that you have. As you write a law, you're changing laws, and you want to cite those other laws and say how you're changing those laws. So it becomes a little bit more complicated, honestly, than simply writing, 5 or 10 or 20 sentences and say, this is what we want to do. But you're absolutely right. We need to write clear bills. We need to make them tight. We need to tell the agencies what we want them to do and what we do not want them to do. And I think that we are paying the price for some of those oversights in the past. Hopefully, we'll do a much better job going forward. I will tell you that my legislative staff, we have been very, very careful, and it really ends up being more work than you'd think. We have tackled it. Just today, we were tackling a medical bill. Finally, we get the legislative language that we wanted. But we worked on it for a number of months, and it's also, let me say, these are group efforts too. So I'm not just us working on it, not me and just my staff, but also other members of Congress and their staff. So everybody's trying to kind of goose this thing. And sometimes you have people writing bills about subjects that they don't know a lot about. And my contribution, I feel, to this particular bill was that they had described a medical condition they wanted covered in law, but they had described it poorly, and it actually roped in a lot of other medical conditions that were not intended to be roped in, and some of them were really, they were cosmetic procedures. They had nothing to do with necessary medical care and things like that. So, we kind of work together on those things and get the right language. But you're right, it's a trick. It's a trap, and it behooves us to be cautious. That's what you pay us to do. Be cautious and write a good bill. And I take your constructive criticism to heart. All right, with that, next question from Panama City Beach, and I can't tell if it's Cliff or Clifton, but Panama City Beach, Cliff.